Okay, hello, my name is Sydney Thompson. I'm the pharmacist here today. So we have a patient here, a 27-year-old female African American whose chief complaint who came in with recent unprotected sexual encounter with her husband and ran out of oral contraceptive pills. She has a treatment of childhood asthma, no treatment for that or symptoms for 8 years. She has generalized motor seizures. It was controlled on topiramate, but she recently discontinued the medications. She's here looking for medication to restart or change for her generalized motor seizures. Her past medical history include childhood asthma and generalized motor seizures. Family history is not pertinent. Social history, she denies recent alcohol and is a former smoker. She quit 3 years ago. Her drug allergies include gabapentin with symptoms of edema, the topiramate 100 milligrams by mouth BID, which she has recently discontinued, and her birth control is the Trisprintec 28-day pack, 1 tablet by mouth every day. She is up to date on all of her vaccines. She got the flu shot in January of this year. Some physical findings were positive for breast tenderness, positive for nausea, positive for intermittent insomnia, positive guarding during breast exam. Her vitals all seem normal. 69 inches tall, 71.5 kilograms with a BMI of 23.3. Her labs, her CMP, her BMP were both uneventful. Her red blood cell count was high on the CBC. Her creatinine clearance is good with 120 milliliters per minute. Her diagnosis test was positive for an HCV and negative for HIV. The problem is going to be the unplanned pregnancy with generalized motor seizures. The patient was diagnosed with generalized motor seizures in 1994 and now has a positive HCG test with breast tenderness and nausea indicating the patient is pregnant. Our goals for this problem is going to be to suggest an appropriate seizure medication to manage these seizures for the pregnant patient and prevent teratogenic effects to the baby. We're going to refer her to the OBGYN for prenatal care and pick a medication that does not cause weight gain, preferably per patient preference, and suggest notifying the pregnancy to the UK Epilepsy and Pregnancy Register. I would like to suggest that we start the patient on lamotrigine, 25 milligrams by mouth daily, and then after 2 weeks we will assess the levels and readjust based on those levels. We also want to start the patient on folic acid, 5 milligrams oral daily for the duration of her pregnancy, starting immediately. We want to make sure to level, for the lamotrigine, we want to measure the serum levels, her LFTs, and the renal function, and the safety. We want to just make sure that her seizure threshold is kept under control and the frequency and duration of the seizures do not amplify. And we also want to monitor suicidal thoughts or depression as a side effect of the lamotrigine. I got my data to pick lamotrigine from the NICE guidelines. The first line treatment for generalized motor seizures is sodium valproate. However, in pregnancy, valproate is contraindicated, so would be unsuitable for the patient. The next line would be lamotrigine if valproate is unsuitable. For pregnancy, according to Lexicomp, monotherapy with the lowest effective dose should be used in pregnancy for lamotrigine, which is why I picked the 25 milligrams once daily, and we will reassess after 2 weeks. And And that's all I have for you. Thank you.